Ask the Expert continues. Scott Watson's here from Watson's Pharmacy and Compounding Center. Entertaining your questions today. We're focusing on pharmacy solutions for children. Our topic during the March break, 613-789-6559, extension 2803. we were talked about eye and ear infections. They seem to be most prevalent among young people, right?
Yes, and often parents will come in with an infant that has, a little bit of pus coming out of the eye, and is there anything I need to do, or should I be going to see my doctor? And a lot of times it's very important to see your doctor, but sometimes it's on a weekend and you just can't. So there are these nice products, polysporin. Most people have heard of polysporin. It comes in a nice ointment for skin. They also make eye and ear formulas, and a lot of those times, about 90% of the time, it's effective for any kind of infant eye infection and children eye infections.
Right.
Now, the general rule we always say is if you're using these products, give it about 2 to 3 days to see if there's improvement. If there is, great. If it's not improving, then do see your doctor. So
really?
That's what we say on those.
Yeah. Okay. What about yeah. You got to talk about it, right?
Right.
And now, it happens all the time.
Young children.
It's not an uncommon thing in schools and daycares, right?
It's not. And you'll often get the letter. There's been some head lice infestation at the school. What are you going to do? And so some parents will come in, gosh, can I get a treatment to treat my kid right now?
Right.
And so the first question is, have you actually seen any head lice in your children's hair? Because you don't want to, again, treat with any kind of medicine
that isn't necessary.
That may not be necessary.
Right.
So the first thing is to make sure you get a good comb. This is a very
the Lice Meister.
It's a very good comb. And what I suggest parents do is put a little bit of conditioner in your child's hair, and then just carefully go from the scalp out to the end of the hair, through the whole scalp, and just see if you can make a diagnosis yourself. Now,
really? What are people looking for?
It could be an active little lice, or it could be a nit, which is usually this little kind of piece of hard black glued onto the hair follicle.
Yeah.
And that is just the preliminary stage of a lice.
All right. What do you do if in fact lice are discovered?
Now, if you discover, there are many different formulas out there. Some people do want to use the traditional NICs, which is very, very effective. Mm-hmm. And that's permethrin, which is a chemical-based solution. And that is just one treatment, and then it works for a full week. If you do see after a week, you might need another treatment. But generally, I think it works really, really well. There are other solutions like these, which are not quite as hard on children.
Right.
And they affect the lice differently. So there are many other different solutions. Some people like natural solutions. Tea tree oil is very good. They make an actual product, but there's shampoos as well that people can use. And if people do want to do something, if they're very concerned, I often suggest tea tree oil shampoos.
Wow.
Okay. Again, just to notice that treatment with these chemical-based products has decreased over time, simply because people have used them too often. So these little lice have become resistant.
Yeah. Okay. We have a question.
We do.
That has come in via Facebook, and here it is. Do you have any recommendations to deal with acid reflux in babies?
Yes.
Babies can have acid reflux?
Absolutely. They get this where, unfortunately, they're throwing up and they're just not happy, and you get this look. So for children, we have to do a lot of compounding. There's a lot of medicines that you and I can take that are in capsules and liquids, and babies just can't take that. So sometimes we have to make these into liquids. We've worked with a lot of doctors to prepare these types of formulas.
Right.
And there's many out there. Nexium, people might have heard of Nexium, Prevacid. These are proton pump inhibitors, which are very, very effective at acid reduction. Mm-hmm. And we've formulated those into suitable liquids for infants. They do have this short expiry date. They kind of, over time in liquid, they don't become as effective.
Right.
But that's a very good question to highlight the fact that compounding some of these medicines into liquids can be very beneficial for babies.
Really? And that's something you do a fair bit of?
We do quite a bit of that, yeah.
Okay, well, we'll take our second break. Give people another chance to ask any questions. Like the acid reflux question is a great one.
Absolutely.
Because it probably happens a lot more than we hear of.
Absolutely.
And it's something you've worked with before. And then we'll come back and go through some more solutions for problems, maybe antibiotic-free solutions that people might consider.
Absolutely.
It's Ask the Expert. Here's the phone number one more time to call if you have a question for Scott on our program today. 613, we're going to put the phone number up. There's Scott's address, by the way, on Main Street. The second address on Willington. And there's his phone number and website. 789-6559, extension 2803 is our phone number if you want to ask Scott a question here on Ask the Expert. We got one more segment coming up, so feel free to do so. More with Watson's Pharmacy and Compounding Center right after this.